So I'll present on the design of the project and implementation, including some of the lessons learned and successes that we had from an implementation standpoint. There should be slides showing up here. So the Change project was a 3-year, 4-country nutrition-sensitive agriculture project. The goal was to improve the nutritional status of children under age 5, as well as pregnant and lactating women. This was to be done by increasing the production and diversity of nutrient-rich foods, improving the intake of these foods, improving key practices in nutrition, health, and hygiene that would have an effect on nutrition and health status, as well as empowering women within the domains of nutrition and agriculture. It was implemented in 4 different countries, rural areas of Côte d'Ivoire and Tanzania, in addition to Burkina Faso, which we'll focus on today, as well as a smaller pilot project in an urban area of Dakar, Senegal. And something that's great about Change, that Victoria touched on in her remarks, is this was a project that was really very much based on evidence about what works and what doesn't work within nutrition and agriculture, and was also really aiming to contribute to that evidence-based. So as Victoria mentioned, we partnered with the International Center for Research on Women to develop and test a gender transformative approach that really aimed to overturn gender norms at their root causes and test the effectiveness of that. HKI also undertook sustainability studies 18 months after the end of the project to figure out what the long-term effects of it were in the project communities. And then in Burkina Faso and Tanzania, we partnered with IFPRI on the randomized control trials that we'll discuss today. So the context for today's project is eastern Burkina Faso. This is an area that is very dry. It has just one short rainy season. People live in dispersed villages, which are often very remote. Nearly all of the population subsists on agriculture, growing food crops such as sorghum, millet, and maize, as well as cash crops such as cotton, and raising some livestock. And overall, agriculture in this area is characterized by low diversity as well as low productivity. So it's not terribly surprising that nutrition indicators are pretty poor in this region. The most recent DHS has stunting in young children at 42% and anemia rates in young children at 91%. So in some ways, this is a very challenging place to implement a project such as this. At the same time, we benefit a lot from having already implemented a similar project funded by USAID in the same region in partnership with IFPRI, which meant that we had a strong base of knowledge to build upon, as well as a really strong implementation team already on the ground. And the goal of the Change project was really to learn from that earlier implementation and to try and test adding different components onto that existing model and seeing what the effect was. So there were 4 core components of the project, all of which were implemented in partnership with the Burkinabe government, as well as a local NGO. The first of these, and really kind of the organizing platform for the entire project, focused on crop production. Within this, we were focused on nutrition. So we wanted to diversify what was grown and to complement what was missing from a nutrient perspective. So look at what nutrients were missing in the diet and what kind of crops could be added to the crop portfolio to fill that out. We aimed for year-round nutritious crop production, and we focused on certain key crops that were great from a nutritional standpoint. Things like orange flesh sweet potato, which is very rich in vitamin A, as well as traditional African vegetables, which are mostly dark leafy greens that are rich in vitamin A, as well as containing some iron, and can be grown under very marginal conditions that other crops can't necessarily. We also focused on appropriate agricultural practices, including the minimal but smart use of pesticides and chemical fertilizers, water conservation techniques, and the integration of crop and livestock systems to improve the efficiency of both. In terms of how we actually did this within a village, HKI and partners would create what we call a village model farm, which is basically a demonstration plot at the level of the village. And that's a place where groups of women within the village could get together and they could receive training on improved agricultural practices as well as inputs. And the idea is they would then use that to create home gardens at their own households to feed their families with these nutritious crops. The second component of the project focused on poultry production. Within nutrition-sensitive agriculture, the inclusion of animal-source foods is really central, as these contain certain nutrients that are difficult to get from plant-based foods. And they're also much more dense in these nutrients, which are more bioavailable, so easier for your body to absorb and benefit from. Within Change, we decided to focus on poultry production. It's because chickens are fairly small, they're fairly cheap, that gives eggs regularly, and eggs are a great source of a lot of different kinds of nutrients. In addition, within this cultural context, it's a lot more acceptable for women to own small livestock like poultry as opposed to larger livestock such as cows. So we focused on the individual level, chicken raising, trying to increase flock sizes by providing subsidies for hybrid or local chickens. And we really focused very strongly on improved practices. Things like providing supplementary feed or adhering to the recommended vaccination schedule can do a lot to boost the productivity, even of local breed chickens. In addition, we had hen houses at village level that served as a training platform. And throughout all our poultry activities, we focused very strongly on consumption. The idea was that these chickens were to produce eggs and meat that were meant to be consumed within the household, particularly by young children and pregnant women. Which brings me to the third component, a very important one of this project, which was behavior change communication on nutrition. Within this, we focused on a core set, the essential nutrition actions, which are proven actions to improve maternal and child nutrition. And these were promoted through the project across many different channels, including group discussions, cooking demonstrations, home visits, and public events, as well as mass media, namely radio. And within this approach, we're not just focusing on the message. It's not just about delivering information, but it's really about negotiating with somebody and working with them to try and adapt and test this practice and be able to adopt it in the long term. The fourth component of the project focused on women's empowerment. One way that agriculture projects can be more sensitive to nutrition is by aiming to empower women. By putting more resources and income in women's hands, we typically find that we have positive impacts on not only their own nutrition and health, but that of their entire families. Within Change Burkina Faso, we did this through a set of cross-cutting activities. One of these was supporting women's land rights through the model farms, where we negotiated at the village level so that women could actually own this land, which is not common within this setting. Gender issues were mainstreamed into all the different tools we used in the project. Working with ICRW, we conducted capacity building for HKI staff, as well as all our partners. And all of our monitoring and evaluation data, we tracked key gender indicators and also disaggregated data so we could track gender outcomes differently. All four of these components were implemented across all 60 of the intervention villages. But due to the research design, which Deanna will go into more detail in later, 45 of the 60 villages benefited from additional activities on water, sanitation, and hygiene. These existed two main areas. One was BCC around the essential hygiene actions, which are a set of core hygiene practices that are meant to break the disease transmission cycle and therefore have a positive impact on nutrition and health outcomes. These are things like washing your hands at key moments. And also community-led total sanitation, which is a set of participatory exercises that aims to motivate a community to want to end open defecation, and then also provides training and support for building latrines. The final project component was giving out small-quantity lipid-based nutrient supplements. These are small packages of a paste that provides the micronutrients required for growth in young children. Within the 15 villages where we implemented this part of the project, it was provided monthly, so a 30-day supply for all the targeted children aged 6 to 24 months. So I've presented these as separate components. In reality, within the project, they were all integrated. So the same person was receiving training on agriculture, on poultry production, participating in WASH activities, receiving nutrition counseling. So it's a very integrated project design. Now I'll talk a bit about some of the successes that we had in implementing the project. I'm not going to talk about impact, as Deanna will take that, but more from a programmatic standpoint. From the agricultural side, we trained 360 resource people in improved agricultural practices. These are people who would continue to live in these communities long after the project ended and could be a source of information on how to practice nutrition-sensitive agriculture within that community. We created these model farms and the poultry facilities in all 60 target villages, and as a result, 75% of the targeted participants received training at those platforms. Almost 3,000 households received inputs and training on nutrition-sensitive agriculture, and over 80% of targeted participants used that to start home gardens at their own houses. As a result, we saw increases in nutrient-rich crop production, as well as in women's chicken ownership and egg production. From the nutrition and WASH side, Again, we trained over 300 local resource people who would continue to be there long after the project ended. Over 4,000 group discussions were held, as well as 20,000 home visits. And these reached 70% of target participants with in-person SBCC, so not through mass media channels such as radio. We successfully provided LNS in the 15 targeted villages, reaching very high coverage levels in excess of 80%. And we also saw improvements in things like having a hand washing station, knowledge of hand washing, as well as knowledge of a number of nutrition practices. Of course, it wasn't all successes. There are a number of challenges along the way and a fair few lessons that we learned through implementation. One of the major ones of these challenges is water. Water is the single biggest constraint that we faced in terms of improving agriculture production, and it's also a barrier to improving water wash practices at the household and village level. This is something that HKI and our partners, we tried to work to improve this by providing technologies such as drip irrigation, by promoting crops that don't need much water, giving training on water conservation techniques. But when you're in a country with a 9-month dry season and you're aiming for year-round nutrient-rich crop production, those kind of actions are a bit of a drop in the bucket. So this continued to be a challenge throughout the project. A second area of challenge was regarding volunteers. For all of the nutrition education activities and a lot of the hygiene activities too within the villages, we relied on community-based volunteers. And this was great in some ways. It made implementation affordable. It meant that we were able to reach deep down in communities and leave behind a highly trained person who would continue to be there after the end of the project. But it also had some drawbacks. A major one of these was motivation. We had problems with volunteers not doing the number of home visits that they were expected to do, as well as with quality assurance. There's a big tendency for people to kind of deliver a lecture to participants in a group, as opposed to really having a discussion, a process of negotiation to try and change behavior. So one of the things that we found was really essential to identify these problems and try and address them as they were going on was a very strong monitoring system. This was a real strength of change. We developed a monitoring system that covered all areas of project implementation across all of the 4 countries, actually. It used mobile phones or tablets to collect data regularly and upload it to a cloud-based server so that we could review results in real time in Ouagadougou or at our regional office in Dakar or here in the US. And that enabled us to identify problems early on in the implementation process and take remedial action so that we could still have good effects on our outcomes. Now, the final challenge that I want to close on is complexity. We see in general that the more broad and the more multi-sectoral nutrition and agriculture projects become, the larger their scope for potential impact. At the same time, this comes with increasing complexity from the implementation side. For an implementer like HKI, this can be a challenge. You have to coordinate actions across a lot of different sectors, and they speak different languages, and they work on different timeframes, and that can take a lot of work. But that's something we can deal with as implementers. We can come up with good management systems, good budgeting systems. We can time things appropriately and monitor them closely. But we can't lose sight of the fact that at the end of the day, all of these different implementations are converging at the level of a single individual in a single community. So we're working with one person, trying to encourage them to adopt a home garden, to start keeping chickens, to exclusively breastfeed their child, to build a latrine and use it regularly, to share tasks with their husband, and to give their children a packet of LNS every day. It's a lot of behavior change to ask of a single individual within a short time period. So I think this is a key subject for us moving forward in this area for implementation research, is to really understand what is a reasonable level of behavior change that we can expect to affect within a fairly short period of time. In other ways, how can we design projects to be broad enough to have impact while still being narrow enough that the change we're targeting is actually realistic? On that note, I'll hand off to Deanna to discuss some of the changes that we did find in Burkina Faso.